Hello people, in this video let us look at Mendelson syndrome. Okay, so this is nothing but the complication of general anesthesia. So when you have given general anesthesia to a person, what can happen? The gastric contents can come up and it can enter the trachea. So basically what they're saying is from the food pipe it is entering the windpipe, correct? So this is aspiration, which is not good. Imagine fluid in your lungs, right? You don't like that. You can't breathe. This happens more in, when in a pregnant female, when you have given general anesthesia for cesarean section, it can happen, okay? Because in these people, the progesterone level is more and there's decreased motilin, okay? So this motility of your gastric emptying is slow. So the stomach will retain the contents and it will come out of the food pipe and it will enter the windpipe. So this is aspiration of gastric contents. This is called as Mendelson's, and this is Mendelson syndrome, and this is a serious and life-threatening. Especially cesarean, they may do in a way where they have not asked the lady to empty her bowel contents, right? So there is more chance of aspiration. Normally, when you go for a surgery, you will you would have been told to come with an empty stomach, remember? But if it is not an elective surgery and if it is an emergency and they are doing, there is more chances of this gastric aspiration, right? And here what the patient will have once he's having aspiration, once he or she is having aspiration, they'll have tachycardia, tachypnea, that is fast heart rate, fast breathing, bronchospasm, bronchi, rales, cyanosis, this no proper oxygen, right? Oxygen, partial pressure less and reduced hemoglobin will be there. Decreased partial pressure of oxygen, hypotension. So basically you will see that these people are having all these distress kind of a thing, respiratory distress kind of a thing. And chest x-ray will reveal that the right lower lobe is involved, okay? So which lobe? Right lower lobe, okay? Why? Because this is connecting directly or something, right? So this is the right and this is the left of the patient. So this one, right lower lobe is affected. You can see that there is more of right lower lobe involvement when you check the x-ray, okay? So what and all can happen with these people? They can develop chemical pneumonitis, lung damage, atelectasis and bronchopneumonia, okay? So all this can happen in that person as a complication. What are the complications? Pneumonitis, lung damage, atelectasis and bronchopneumonia. What is atelectasis? That is collapse of the lung, right? Partial or complete. So this and all will happen, okay? So why is right lower lobe involved? As the aspirated food material reach the lung parenchyma through the right bronchus. To the right bronchus, it is easily able to reach, okay? Now, how will you manage this person? So guys, we are moving on to the management of this Mendelson's syndrome. Pay attention now. So you have to suction the oropharynx and nasopharynx. You have to remove this inhaled fluid. Bronchoscopy you do, and you check if there is any large particulate matter. Okay, then you go on giving positive pressure ventilation. You'll maintain arterial saturation of 95%. Pulse oximeter, if you have, it is good, then you can measure. Otherwise also the breathlessness, the respiratory rate will tell you all this. Antibiotics are administered only when you think there is an infection, okay? So that is about the management of Mendel's syndrome, right? So just you will give oxygen and ventilation and you will maintain the arterial saturation. If there is any aspiration material, you will remove it, okay? That's it about Mendelson syndrome. Bye bye.